Now, we move on to our next speaker, who's Michael Gottstein, who is the head of sheep knowledge transfer in Teagasc. Michael's family originated in Germany, is a native German speaker, and is a UCD agriculture graduate. He has both a bachelor's and master's degree, a master's in nutrition. He's worked as dry stock specialist and a sheep specialist. He's gained a graduate diploma in farm financial management as well, and he was appointed the head of sheep knowledge transfer in 2012. In his spare time, Michael breeds pedigree sheep and cattle, and anyone that knows anything about pedigree cattle and sheep say that they're of very high quality. So what we want, we've asked Michael to, in his experience in knowledge transfer, to talk us through a series of case studies where disease had a profound effect on farm profitability. So over to you, Michael.
Okay, thanks, Damien. And thanks for having me on, giving me the opportunity to chat to people a little bit about the title there, proactive approach to flock health, and how basically being proactive when it comes to flock health can improve your performance. And look at I think I'm probably saying some of the things that the previous three speakers have already mentioned, but in terms of maximizing flock performance, it really requires a focus on nutrition. So that's having a balanced diet, whether that's grass, silage, hay, concentrate feed, minerals, having sufficient nutrients as well. And I know there's people going to talk a little bit about body condition score and things, and have already avoiding metabolic issues, focus on genetics. And we're very fortunate in Ireland that we have Sheep Ireland that do our genetic evaluations for us. And part of that focus on genetics is looking at things like lamb survivability, growth rates, but also, more recently, we're looking at selection for various different health traits, things like lameness, DAG scores, mastitis resistance. So they're not a big part of the index yet, but that's an aspect that's growing. And we also have genomics, and a lot of information being gathered there as well. Removing problem sheep, as well, being able to identify them and remove them. And then I suppose very, very relevant for this evening's webinar is a focus on a flock health plan and flock health planning. And I'm going to use a line there, Damien, from one of your colleagues, Marissa Sheehan, who at one of our recent webinars mentioned that one of the important points really is knowing what's going on in your flock. And I think that we cannot overestimate this particular thing. Really, people need to know what's going on in their flock, and then once you know what's happening in your flock, what diseases are there, having a plan to control or prevent that disease. In some cases, maybe it's about preventing it, eliminating it. In some cases, with some of these iceberg diseases, maybe we can't eliminate it, but we need to basically control it. Okay, so look, I'm going to really tell a few stories, and these are stories of real farmers that me and my colleagues have dealt with over the last number of years, and issues that have arisen on these particular farms. So the first farm I'm going to talk about is a large farm. It's a dairy, beef, sheep and tillage farm. It has 450 ewes, which includes 50 ewe lambs, which are mated annually. And when we visited this particular flock in 2015, there was a considerable lameness issue on the farm. Really, an awful lot of the sheep were lame on the day we visited. Ewes were lame, and lambs were lame. And there was an awful lot of antibiotics used in the control of lameness. So we visited the flock, myself, the local advisor, the local vet, and the people that were running the flock, and we followed that with a flock health plan. And in terms of, there was lots of aspects to that particular flock health plan, but in terms of just taking the lameness here as the example, we identify the lame sheep and treat them, improve the handling facilities, and incorporated a batch foot bath. And this really significantly reduced the lameness in the flock. But more importantly, what it did is it significantly reduced the antibiotic use in the flock as well. It increased animal performance and it reduced the costs and the labour requirement. There was an awful lot of labour associated with catching and treating lame sheep. And for this particular farm, we have some very, very good records. That's a picture of the batch footbath down there with the lambs standing inside it and the revamped handling facilities on that particular farm. And this is an example of the amount of antibiotics that were used on this particular farm just for the control of lameness. So what we did is we had a look at all the kind of vet meds that were bought on the farm in the 2 years, and then we were able to pretty much identify which ones were used for lameness control. And we can see in 2015 there was 33 100 ml bottles of Valamycin 300 used for lameness compared to 4 in 2019. 9 bottles of Pen Strep compared to none in 2019. Cyclospray, which is an antibiotic spray, 9 bottles used in 2015. There was 5 bottles used in 2019. They were used for lambs for scald when they were vaccinating the lambs for ORF at 5 weeks of age, and they didn't want to run them through the footbath at that stage because they were afraid that the foot bathing procedure would wash off the vaccine when the lambs had just been treated. So alone from, we'll say, a cost point of view, there's a huge saving there. As you can see, the cost of the antibiotics reduced from 900 euros down to 145 euros, but also there's the whole area of AMR and the need for us to reduce antimicrobials in food producing animals. And then there was a significant reduction in labor, a significant increase in animal welfare and animal performance. Okay, our second farmer example here is a farmer who has lowland sheep and also a separate hill sheep flock plus a number of suckler cows selling weanlings. And on this particular farm, we have 320 hill ewes. In 2016, he lost an awful lot of ewes with pneumonia shortly after housing. And he also had issues with ewes wasting, a lot of ewes maybe not even coming down off the hill, you know, higher mortality. Sent a few ewes that died from pneumonia to the regional veterinary lab, and OPA was identified. We drew up a flock health plan with this particular farmer, and we brought down Patrick Grant from the north to scan the lungs of the ewes. The plan here was that we were going to scan the ewes every 6 months at 6 monthly intervals, and then basically the ewes would be divided into 3 groups. Ewes that were positive for culling, ewes that were inconclusive, which would be kept as a separate group and rescanned again 6 months later, and then ewes that were clear. Cull the infected sheep, and then also on this farm we did have parentage, so we were able to trace daughters from infected ewes, and these were also selected for culling. Just an example of this flock, and Chris was mentioning some of the levels of infection that they saw in flocks. And this particular flock, the first scan was in 2018, and in that scan, out of 400 ewes, there was 40 ewes that were infected. So 10% of the flock were infected, and they were culled. There was a number that were also inconclusive, and when they were rescanned, they were also infected. So the second time around when he was scanning, he didn't even keep the inconclusive ones. He sent them straight for culling. 2019, we were down to 4% of the ewes being scanned as being deemed infected. And in 2020, our scan was delayed due to COVID. But speaking with the farmer just a couple of days ago, he's very, very few thin ewes, no sheep with clinical signs, no issues with ewes getting pneumonia and dying at housing time. And look at the, you know, he also mentioned that apart from we'll say being able to identify these ewes, earlier there was a significant cull value with the ewes now when he's identifying ewes, as opposed to before ewes that were really, you know, almost on death's door, and boners, you know, very little cull value in a lot of the ewes by the time he identified that they were clinically sick. And then just looking at the performance on this particular farm, so in the 2017-18 season, so mating 2017, lambing 2018, we had a pregnancy rate on this farm of 80%, 400 ewes, a litter size of 1.2 and a scan rate of 0.96. You know, so 20% of the ewes were empty at scanning time. 2018, 2019, once we started scanning and removing the ewes, 88% pregnancy rate, litter size again 1.2 and a scan rate of 1.06. And in the 2019-2020 season, so the season, the lambing just gone by, 91% pregnancy rate, litter size of 1.25 and a scan rate there of 1.14. So we can see there's a significant productivity increase on this farm as well, by virtue of the fact that he's trying to get on top of this disease and reduce the number of infected sheep in the flock and the spread throughout the flock. So then, Damien, I suppose my third farmer example is a Lowland sheep farmer. He also keeps some suckler cows, keeping the calves to beef, and has a tillage enterprise. And on this particular farm, we had 400 ewes plus 90 ewe lambs. We had a very, very poor reproductive performance in the ewe lambs when we compared it to the ewes. So the adult ewes had, very good reproductive performance, and that we would have expected a much higher reproductive performance rate in the ewe lambs on this particular farm, but weren't getting there. At scanning time, we were noticing, or the scanner was kind of identifying a few ewe lambs that maybe had been in lamb, but had lost it or had dead fetuses that were reabsorbing. And then we had a few abortions as well in ewe lambs. So in 2016, the Regional Veterinary Lab identified toxoplasmosis in the ewe lambs. In 2017, this particular farmer started vaccinating for toxoplasmosis. And so look at, again, just to show, going back to what I mentioned earlier, the importance of knowing what's going on in your farm, identifying what's happening and then taking steps. So on this farm in 2016, we had 90 ewe lambs joined to the ram. We only had 56% of those that scanned, that lambed down, because the rest of them, either reabsorbed or aborted. And lambs reared per ewe joined was 0.71, which would be pretty poor performance compared to the flock that was kind of, rearing 1.7, 1.8 lambs for the mature ewes. In 2017, once vaccination had been initiated, 89 ewe lambs to the ram, 79% of them lambed down, and lambs reared per ewe joined of 0.92. And in 2018, 75 ewe lambs joined to the ram, 92% of those lambed down, and the lambs reared per ewe joined there was 1.09. So again, look at a significant increase in performance. Lots of extra lambs there on that particular farm to sell. And also a lot less work at lambing time, because anyone who's lambing ewes will know that when you have ewes aborting, it's no fun inside in the lambing shed, trying to get those lambs out of those ewes, and trying to deal with weak lambs if they're alive, and trying to keep them alive, and trying to deal with ewes that have infections afterwards, and the whole workload in terms of trying to isolate these ewes and keep them separate and disinfect pens and all that type of thing. So look at it in summary. 3 points for people to take home, really. And the first one is a comment that a farmer said to me a number of years ago when I was out on his farm, and he said, look, at a good vet will save you money, not cost you money. And very often we look at expenditure on veterinary planning and things like that, investigations, as a cost, but really, it should be saving us money. And in all the examples I've given, basically putting in that flock health plan, yes, there was an initial outlay in terms of either scanning or building a new handling facility and putting in a batch foot bat or vaccinating, but it saved an awful lot of money and time and effort, and increased the margin on the farm. And look at flock health plan. A flock health plan is an essential tool, and every farm should have a flock health plan. It doesn't need to be terribly complicated, but it needs to be a number of people, a vet, maybe your advisor and yourself, who sit down and plan out what's going to happen during the year and when are the key times to do essential tasks like vaccination, or what's your protocol for buying in stock, your biosecurity measures that you will be taking to help maximize your animal performance and the profit. And the third and very important point here, Damien, again, is be proactive about tackling these health issues in your flock, because they don't go away. The one thing we've seen is, you see a little bit of these things the first year, the following year it gets a little bit it gets worse, and the following year it's really, really bad. We often see that with things like enzootic abortion. You see a few cases, and a couple of years down the road you're in a storm, abortion storm, and it's not a nice place to be. So be proactive when you see something, tackle it, and do a plan. So that's me. Thanks very much for your attention.
Thanks very much, Michael. Thanks very much for giving us a very comprehensive overview of the elements of what leads to good productivity and performance of on flocks, along with the flock health plan. Combined with nutrition and genetics, and these are the three legs on the stool. I think a key message there is in terms of the lameness in that flock is the antibiotic usage, and we all know of the cost. It can be it's relatively easy to quantify the costs, I suppose, but there's also a high level of anxiety that goes with having health issues in your flock like that, no more than with an abortion problem. And it's notable that once these diseases were brought under control, there were significant increases in performance. I think your talk, Michael, has tied in well with Chris's talk on OPA, just given a real life Irish example of when OPA, a plan is put in place for OPA, how quickly it can reap rewards.